Well, that's WHO on antibiotics. But you've heard of the COVID organics from Madagascar. Well, that is one alternative, traditional complementary and alternative medicine to COVID-19. But what is Nigeria doing? We find out as the pharmacist, Joseph Gia, an assistant director, head division, complementary and alternative medicine, Department of Traditional Complementary and Alternative Medicine, Federal Minister of Health, Abuja, joins us on the program. Glad to have you join us. Thank you. First, we'd like to know, indeed, what, or rather, how involved is the traditional complementary and alternative medicine practitioners in finding a solution to COVID-19?
All right. Thank you so much. I think the first thing is actually to know what traditional medicines are, because there's a lot of confusion in the minds of people as to what traditional medicine, complementary alternative medicines are. Traditional medicine has been with us since ages, and these are the medicine practices that our forefathers used that has kept them, kept us also alive up to today. And these are practices that have been handed over from ages to ages, like WHO said, whether they are explainable or could not be explained, but they have been seen to work. And then the complementary alternative medicines are medicines, practices that are outside of the conventional medical practice for now. So the traditional medicine department of the Federal Ministry of Health has continued to receive a lot of questions, just like we ask now. And the first fact we need to do is that in Nigeria, we have over 8,000 species of medicinal plants that are there and are waiting for use by researchers, by people on the field. We have a lot of a different group of people actually working on these plants. We have the researchers, we have the practitioners who actually are not into laboratory analysis, but they have been using these plants for years. And so at the beginning of the pandemic, when there was confusion, there was this helplessness, the traditional medicine came up. We remember nations who have come up with remedies from plants that could be used in managing COVID-19.
So, Mr.
Some
Gia,
to manage the symptoms.
I must quickly ask you, Mr. Gia, how close is Nigeria to finding something that it can use as treatment or as a vaccine for COVID-19?
All right, thank you. Nigeria is moving very fast, I would say, because quite a lot of people have done some works who have actually got in touch with the ministry. About 3 weeks ago, there was this teleconference with those who have claims, and they were listened to. And like you and I know, the first thing for a drug to be approved for use in Nigeria is that it should be subject to scientific evaluation, and this is done by NAFDAC. And as at now, that process is on to get these practitioners, these researchers who have products, quite a lot of them. The products are there, the claims are there, let me call them claims, of people who have a lot of claims. We have quite a lot of them, and they are just being forwarded to NAFDAC to evaluate them and to see if they are actually fit for human consumption and if they are fit to do what they actually supposed to do. As at now, that is the level at which the ministry is. And it is ongoing. More and more claims are coming up. People are bringing in more claims, writing to the ministry. We have this, we have that. And the ministry is looking at those claims and forwarding them to the relevant agencies that will look at these claims, evaluate them, and come up with a remedy. I want to believe very shortly remedies, not just remedies will come up from these claims that could be used in tackling this menace that seems to, not to answer to the conventional method or the conventional medical practice for now. While they do the research in the laboratories, these ones are available. And I want to believe very shortly, like I said, they will be made available, but that definitely will be after evaluation by NAFDAC.
And validation. We appreciate your time, Mr. Joseph Nathaniel Jia, Assistant Director, Head of Division, Complementary and Alternative Medicine at the Federal Ministry of Health. Thank you for joining us on the program.
Thank you for having me.